There's a quiet conversation happening in living rooms all over the world right now. A grandmother holds a birthday card 3 inches further from her face than she did last year. A retired gentleman squints at a road sign he used to read without thinking. A woman wakes up, rubs her eyes, and waits 10 minutes for the world to stop looking like it's been rubbed with petroleum jelly. Almost every one of them has been told the same thing. It's just your age. Get used to it. Buy stronger glasses. But that explanation, in my honest professional opinion, has been doing real harm for decades. My name is Dr. Pardip, and I've spent the better part of my career sitting across from patients in their 60s, 70s, and 80s who were quietly grieving their own eyesight. What I've learned is this: blurry vision after 60 is rarely just clockwork. It is, far more often, a measurable cascade of biological events happening inside the eye, and many occur not while you're awake, but while you're asleep. Your retina, that delicate sheet of light-sensing tissue at the back of each eyeball, depends on overnight oxygen and nutrient delivery to repair the wear of the day. When circulation falters, when oxidative stress builds, when low-level inflammation simmers in the small vessels behind the eye, the photoreceptor cells responsible for crisp vision begin to break down in a way nobody warns you about. The American Optometric Association is clear that adults past 60 face dramatically higher risk of dry eye, cataracts, and macular degeneration. And the National Eye Institute has flagged that age-related vision loss is climbing faster than this country has ever seen. Here is the question I receive almost every Tuesday afternoon. Doctor, is there anything natural I can actually do? Something that doesn't involve another prescription bottle or another procedure? The honest answer is yes, more than most people realize, and the science underneath it has gotten genuinely interesting in the last decade. Certain everyday fruits, eaten in a specific way at a specific hour, contain compounds your retina is quietly hungry for during the deepest hours of sleep. They can support photoreceptor regeneration, improve blood flow to the back of the eye, and slow the silent grind of macular damage that steals so many people's independence after 70. Today I'm walking you through 7 of them, counting down to the single fruit that contains a natural enzyme research suggests interferes with one of the most destructive processes behind cloudy lenses. Before we begin, drop the city you're watching from in the comments. I read them and I love seeing where this community lives. One important note: everything that follows is educational, not a substitute for a real consultation with your eye doctor. If your vision is changing, please do not skip that appointment. Number 7 on the list is the kiwi. Small, fuzzy, easy to overlook in the produce aisle, and yet for older eyes it is a quiet workhorse. The retina behaves like film inside an old camera. Decades of light exposure leave fingerprints on it, and after 60, the natural repair cruise slows down. Kiwi delivers 2 pigments, lutein and zeaxanthin, that behave like tinted lenses built directly into your retinal layers, absorbing harmful blue wavelengths and quieting the oxidative storm overnight. It also carries a small dose of natural serotonin precursors which gently support deeper sleep, and deep sleep is when retinal repair actually happens. A clinical paper out of New Zealand reported that older adults who ate 2 golden kiwis daily noticed measurably sharper vision and far less morning dryness within weeks. Eat 2 golden kiwis, not green, about an hour before bed. The golden variety has more lutein and is gentler on a late-night stomach. Scoop the flesh out with a spoon and don't dig too close to the skin. That thin inner edge is where caffeic acid concentrates, one of the most potent antioxidants in the whole fruit. Number 6 is watermelon, and this matters most for people who wake up feeling like their vision needs to warm up before it works. As we age, ocular hydration drops and retinal blood supply slows, which is why so many people fight that hour-long fog every morning. Watermelon is more than 90% water, but the real story is lycopene. Think of lycopene as a fire blanket draped over the small vessels behind the eye, smothering low-grade inflammation before it does damage. Regular watermelon eaters tend to carry higher circulating levels of lutein and zeaxanthin too. Compounds inside the rind also support nitric oxide production, which widens the smallest capillaries feeding the retina at night when oxygen demand is highest. Eat 1 to 2 cups of chilled seedless watermelon roughly half an hour before bed, and please do not salt it. The Glaucoma Research Foundation has long flagged sodium as a driver of intraocular pressure. Don't toss the rind. The white layer holds citrulline, an amino acid that supports vessel health. Blend it into a smoothie if the texture puts you off. Number 5 may be the most unfamiliar name on this list, the blackcurrant. Tiny, deeply purple, and almost invisible in American supermarkets. But for the patient who finds night driving more anxious than it used to be, blackcurrants are remarkable. They target microinflammation in the retinal capillaries and weaken blood flow at the head of the optic nerve. Their anthocyanins, the pigments that give them their dark color, act like a dimmer switch, resetting itself, helping rhodopsin, the visual pigment that adjusts your eyes from bright light to darkness, recover faster between the sun and the headlights. A 2-year placebo-controlled trial in glaucoma patients found that 50 milligrams of blackcurrant anthocyanins daily meaningfully improved blood flow to the optic nerve and slowed visual field loss. A separate pilot in normal tension glaucoma reported similar circulation gains without raising eye pressure. Because fresh berries are nearly impossible to find here, look for a standardized blackcurrant anthocyanin extract around 50 milligrams in the evening. Pair it with a small piece of orange or a few walnuts. The combination of vitamin C and healthy fat genuinely changes absorption. Number 4 is the blueberry, which most people already buy and most people misuse. Blueberries target oxidative wear on photoreceptor cells, the cells that allow you to read fine print and recognize a face walking toward you in dim light. Their hero compound is pterostilbene, a cousin of resveratrol but considerably more bioavailable, and research suggests it actually crosses into retinal tissue rather than simply circulating in the bloodstream. A 2023 paper in Nutritional Neuroscience reported that older adults who ate wild blueberries daily for 12 weeks showed visible improvements in visual sharpness and far less eye strain in low light. Here is the catch most people miss. The big shiny blueberries in plastic clamshells contain noticeably less of the active compound than the small dark wild blueberries in the freezer aisle. Eat about 1/3 of a cup roughly 45 minutes before bed and do not pair them with milk or yogurt. Dairy proteins lock onto anthocyanins like a magnet and physically prevent absorption. Light freezing and thawing breaks down the cell walls and releases more antioxidant content. Number 3 surprises almost everyone, dragon fruit. Vivid pink outside, and the variety matters here. You want the deep red flesh, not the white. The white version simply does not deliver what we are after. Dragon fruit targets retinal hypoxia, the quiet starvation of oxygen that explains why some people sleep 8 full hours and still wake up with heavy, tired eyes. The betalain pigments in the red flesh support nitric oxide production, opening the smallest vessels behind the eye like a traffic controller waving cars through a previously congested intersection. A 2022 paper in Frontiers in Aging Biology reported that participants taking red dragon fruit extract for 6 weeks saw improvements in ocular circulation, contrast sensitivity, and visual field depth. Eat half a red-fleshed dragon fruit about an hour before bed and chew the black seeds rather than swallowing them whole. They contain omega-3s and magnesium that directly support retinal nerve repair. Number 2 is the goji berry, used in traditional Chinese medicine for over 2,000 years, specifically for the eyes, and now finally backed by clinical research. Goji berries target macular thinning, the slow degradation of the retina's central zone responsible for the sharp detail you use to read, recognize faces, and see color clearly. They are among the highest natural sources of zeaxanthin on the planet, and zeaxanthin concentrates specifically in the macula like a custom paint job applied only to the part of the canvas that matters most. A 2021 nutrient study followed adults aged 60 to 80 who ate dried goji berries 5 days a week for 90 days. Macular pigment optical density rose meaningfully, and not a single participant showed further progression of macular degeneration. Soak 2 tablespoons of dried goji berries in warm water for 10 minutes and eat them about half an hour before bed. Pair them with a small square of dark chocolate, 85% cacao or higher. The flavonoids in cocoa enhance zeaxanthin absorption noticeably. And number 1 is the papaya. Not exotic, not expensive, possibly already in your kitchen. Papaya targets glycation, the silent process by which excess blood glucose binds to proteins inside the eye, forming advanced glycation end products that progressively cloud the lens and erode the retina. Glycation is one of the most underappreciated drivers of age-related vision loss, and it happens continuously in most people over 60. Papaya delivers papain, an enzyme with documented protein-modifying activity that helps the body clear damaged proteins, like a cleaning crew scrubbing burnt residue off a stovetop before it hardens. It also brings vitamins A, C, and E plus folate, all linked to tear film stability and retinal protection. A 2023 paper in Clinical Gerontology reported that older adults eating papaya in the evening showed lower glycation markers, better tear production, and measurable contrast vision gains within 6 weeks. Eat 1 cup of ripe papaya cubes about an hour before bed, fresh, never canned, and let it warm to room temperature first. Cold suppresses papain activity. Squeeze fresh lime juice on top. The vitamin C boosts vitamin A absorption and the flavor improves dramatically. 5 rules to make this work. First, keep dairy 90 minutes away from your evening fruit. High calcium meals can reduce lutein and zeaxanthin absorption by up to 30%. Second, add a small amount of healthy fat, a few walnuts or a teaspoon of flax oil. Most of these compounds are fat-soluble, and without that escort, they pass through unused. Third, wash gently. Hard scrubbing strips surface antioxidants, especially on berry skins. Rinse softly under cool water just before eating. Fourth, room temperature beats refrigeration for enzyme-containing fruits like papaya. Pull them out half an hour before you eat. Fifth, timing is everything. The window is 60 to 90 minutes before bed. Earlier, and the compounds are metabolized away. Later, and digestion disrupts the deep sleep your eyes need. Blurry vision after 60 is not a sentence handed down by your birthday. It is, in many cases, a process that responds to thoughtful, evidence-informed support. Imagine reading a book without the fog. Imagine driving at night without that white-knuckle grip on the wheel. Imagine waking up tomorrow and seeing the people you love clearly within seconds, not hours. Tell me in the comments, if your eyesight cleared up tomorrow morning, what is the first thing you would want to look at? A grandchild's face, a sunrise, your garden in full bloom? I read every answer. If this video gave you something your last appointment didn't, please hit the like button and share it with someone over 60 who deserves to hear it. Subscribe for more evidence-informed natural approaches to protecting the most irreplaceable part of you. I'm Dr. Pardip. Take care of your eyes.